Hello everyone, I am Dr. Anil Kamath. I am a senior consultant surgical oncologist here at Helios Cancer Clinic. So, September is Thyroid Cancer Awareness Month. So, I'll use this opportunity to talk to you all about various aspects of thyroid cancer treatment. So, one aspect of treatment is what happens after surgery. What is the complete treatment of thyroid cancer? In my previous video, I discussed about surgery for thyroid cancer. Thyroid cancer is one of the most curable cancers, and if it is properly treated, most of them will get cured. But what happens after surgery? Surgery, as I said, usually involves removal of the thyroid gland. If it is a low risk, we can go for a hemithyroidectomy. If it is high risk, we need to remove the whole thyroid along with the surrounding lymph nodes, a procedure we call as total thyroidectomy and lymph node dissection. But surgery alone is not sufficient for thyroid cancer, especially if it is a high risk group. Following surgery, we advise another treatment, and this is called radioiodine ablation. Radioiodine scan and ablation. So, there are various ways of doing it. The normal traditional way is to wait 1 month after the thyroid cancer surgery, after a total thyroidectomy. During this period, there will be no thyroid hormone in the person's body and they will become hypothyroid. So they may develop some symptoms of hypothyroidism like puffiness of the face, a little weakness, etc. The reason we do this is to deliberately make the patient hypothyroid so that the TSH level goes up. So at the end of 1 month, when we repeat the thyroid function test, the TSH, we expect the TSH would have gone up quite high, sometimes more than 50 or even more than 100. So this is the best time to do the radioiodine scan and ablation. In this, first a scan is done giving a small amount of radioiodine to see where all the residual thyroid is there. The residual thyroid may be just in the neck at the thyroid bed. It's quite common to find some amount of residual thyroid in the thyroid bed, or it may be present in other areas like the lung or in the bones. So depending on this, the nuclear medicine specialist decides how much dose of further radioiodine is to be given. Depending on this, a higher dose of radioiodine is given to ablate the residual thyroid tissue, and if there is any metastasis, to ablate this also. So depending on the dose, the person may have to have a period of isolation. Since this is a radioactive material, if a high dose is given, he can't freely mingle with other people. So person has to be isolated for some period of time. The ablation work most of the time works very well, and when the scans are further done, we'll see that the thyroid has been ablated. So surgery along with radioiodine forms the most important part of the treatment. But there is one more treatment also. Following radioiodine treatment, now we have kept the patient hypothyroid and we need to start them on thyroid hormone replacement. So the replacement is done in a manner in which it is slightly higher than what it is required. Say if the normal requirement is 100 microgram, we tend to put the patient on 125, 150 microgram. This is a part of the treatment. The purpose here is to suppress the TSH. So with the higher dose, we want the TSH to be suppressed. So TSH suppression also means cancer suppression. And this suppression will continue for the next 5 to 10 years. So, but there are some problems which can happen because of the higher thyroid hormone levels. One common problem which we frequently come across is that the patient is unable to tolerate this higher dose. They feel palpitations. So in these cases, we may have to modify the dose to something much lesser. So this is how thyroid cancer treatment goes after surgery. Thank you.